address. As mentioned, my name is Nazia Maksudi, and I am a Master of Global Affairs student at the University of Toronto's Munk School, and I'm also the chair of the Board of Directors for Canadian Students for Sensible Drug Policy. I'm joined today by Lisa Campbell, CSSDP's Outreach Director. CSSDP is a national grassroots advocacy network of student and youth chapters working autonomously through Canada and their communities to reform drug policy. CSSDP advocates for pragmatic, evidence-based drug policies that prioritize the health of people who use drugs above all else. Lisa and I are here today to discuss the ongoing challenge of drug-related deaths and health complications among young people in party settings. These deaths have a devastating impact on society, and action must be taken to put an end to the senseless and unnecessary loss of lives. You may recall that this past August, there were 3 drug-related deaths at music festivals in Canada that gained a great deal of media attention. However, it's important to note that this is not a new problem. In 2000, the City of Toronto launched a coroner's inquest into the death of Alan Ho. Unfortunately, many of the recommendations from this inquest were not implemented, but it shows us that this has been a problem in our community for over a decade. And unfortunately, this isn't a problem that only affects 1 or 2 people a year. As the article that we have along with our brief in the back of the room indicates, 25 people died in 2012 on the West Coast alone from drug-related overdoses in party settings. So it's important to note for the purposes of our presentation that we're referring primarily to substances that are sold in electronic music events, such as MDMA, that fall in the class of amphetamine-type stimulants, or ATS. This class of drugs is now more prevalent in North America than opiates, which you may know as heroin or Oxycontin. Although drugs have remained relatively popular among young people for the past decade, there are 3 key reasons why young people are more at risk for drug-related deaths and health complications now than they have been ever before. First, over the past 5 years, there has been a significant increase in new psychoactive substances, or NPS. These are essentially slightly tweaked versions of traditional drugs in order to be sold legally. But of course, slightly tweaking their chemical compounds significantly affects toxicity. NPS are often used as adulterants in traditionally used substances, which lead to unpredictable, undesirable, and often very negative and deadly effects. The rise of NPS is an issue of international concern, but it essentially means that young people are consuming substances that consist of chemicals that they are not aware of and that differ from what's advertised, and therefore lead to very negative outcomes. Now, this would not be so problematic if young people were aware of the rising variety of adulterants in their substances, which brings me to the second reason why youth are currently at greater risk of drug-related death and health complications in party settings. There's recently been an unfortunate shift in understanding of drugs commonly used in party settings, particularly MDMA, which has been advertised as a pure form of ecstasy. At Veld Music Festival, which was one of the places where there were 2 drug overdose deaths this summer, a CSSDP board member witnessed youth that identified actively as MDMA users laughing at educational pamphlets on methamphetamine or meth, not recognizing that their active consumption of MDMA likely has led them to ingest some meth as well. When this was brought to their attention by the CSSDP board member, they were adamantly insisting that their MDMA was and always was pure. Evidently, our on-the-ground experience working with youth has indicated that they fail to recognize that their substances are often cut with chemicals other than what is advertised to them. Thirdly, young people are also ill-informed of the strategies to reduce drug-related harms and what to do in the case of a medical emergency. Also at Veld Music Festival, a CSSDP board member saw one of the later overdose victims having a seizure on the dance floor and people trying to force him to vomit and not seeking medical attention. Unless improved, the lack of information will continue to lead to deaths and health complications among young people. So this rise of new psychoactive substances and the inadequate information of drug risks among young people, combined with this long-standing popularity of drugs being used in party settings, means that deaths and health complications among young people are unsurprising. But good news, they're not unavoidable. Instead of victim blaming and treating the recent tragedies as warnings against illicit drug use, CSSDP strongly believes that all levels of Canadian government should prioritize the health of young people by taking action to increase product information and thereby reducing the systemic risks associated with drug use. Lisa will now discuss drug checking, an evidence-based public health strategy used all throughout Europe that can prevent drug-related deaths and health complications right here in Canada.
Drug checking is a harm reduction service that helps youth identify and avoid ingesting unknown and potentially dangerous adulterants found in drugs. By providing youth with accurate information on their drugs, we can empower them to modify their use and make educated choices. Drug checking does not endorse drug use, but sends a clear message to young people that society actually cares about their well-being. This pragmatic harm reduction approach acknowledges that despite efforts to prevent drug use amongst youth, there will always be a segment who choose to experiment and are still deserving of public health services. Drug checking services are part of nightlife safety strategies implemented across the European Union in partnership with local governments, hospitals, public health units, and key stakeholders through the Nightlife Empowerment and Wellbeing Network. There are many models of drug checking that have been evaluated as standard good practices by this EU-funded initiative, including mobile settings, which use the same methods employed by law enforcement in the field. Using drug checking kits, youth can use a dropper to test their drugs in a small test tube, and depending on what color it changes, it will give them more information on whether the substance is the one they intended to consume. These mobile tests are easy to use and can be distributed to youth so they can conduct the tests themselves. As well, drug checking also takes place in laboratory settings. These labs often already exist in hospital poison control units and are operated by professional lab technicians. As technology rapidly advances, researchers are finding ways to create mobile versions which can be used in the field. When Nazli and I were in Vienna last March, at the high-level segment and 57th session of the Commission on Narcotic Drugs, we had the opportunity to visit a drug checking service called Check It. Check It is a federally funded harm reduction organization that includes a range of holistic health services, as well as drug checking in partnership with the Vienna General Hospital. Check It also provides mobile drug testing and electronic music events and festivals, where the results are published on posters that advise partiers of dangerous batches of drugs. Check It and other drug checking services in Europe have demonstrated the following public health outcomes. Firstly, drug checking provides early intervention to youth, including drug education, information on health services, peer counseling, HIV and Hep C prevention, and access to naloxone for opiate users. Drug checking services are not only an advanced laboratory, they're a public health service that links youth directly to care. For example, in Check It, the main office is full of drug information on every substance you can imagine, including emerging new psychoactive substances which have been identified through their drug checking service. Check It also employs peer educators from the community, as well as professional psychologists that offer counseling services and group therapy for youth facing addiction. Thus, drug checking can assist in lowering both short-term and long-term negative effects associated with substance use through increased supports and services. Not only does drug checking improve the health of young people, it also provides government with public health epidemiological data and increases their ability to respond to drug-related emergencies. Youth can benefit from understanding the purity and potency of drug samples analyzed directly in their communities. The government, as well as workers and researchers in the health field, can also use this info to further their understanding of the drug market and create more effective prevention, harm reduction, and treatment programs. Check It shares all of their data with the Austrian government, which is also shared across the EU, as well as globally through the UNODC. The Austrian government has a realistic idea of what drugs are on the market and can quickly respond to potentially dangerous drugs by issuing alerts instead of waiting years for coroner's data to be released. Finally, it's been demonstrated that drug checking services result in a direct reduction in deaths associated with adulterants and lower rates of problematic drug use by providing consumers with accurate information on their drugs. For example, Check It prints out alerts for samples which combine 2 or more drugs, have potentially deadly adulterants, or high rates of purity, each which could lead to overdose. Thus, drug checking provides early intervention to youth, providing them with life-saving information to reduce drug-related harm. Evidently, the beneficial public health outcomes from drug checking services are essential to the health of young people who use drugs. Due to an unfavorable legal environment, drug checking services have not been implemented in Canada. It's time for governments to stop the cycle of death and take action to prevent overdose. It is imperative that we partner with existing organizations working with young people to remove barriers to drug checking and legally protect frontline health workers. Youth need drug checking services, and they need them now. Thank you for your time, and we look forward to taking your questions.